Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
This is a woman that everyone should know, especially if you live in South Florida, and her name is Mary Barnes. She's the CEO of Alzheimer's Community Care, and she has a long history of caring. Yes, caring for a lot of things, but mostly for people and their family members who are afflicted with Alzheimer's. And Mary, you know, we always jump into this so easily as though everybody understands Alzheimer's. Let's let you be the person who explains what Alzheimer's is to our listening audience who may not really know.
Well, Alzheimer's disease itself is a neurocognitive disorder, and it's a terminal illness that's neurological. It's irreversible, it's progressive, and one can die from it. A lot of times that's been misunderstood because there has not been, when a death certificate is issued from a physician, they usually mention what it is and state what they died from, kidney failure or other kinds of pneumonia, because a lot of times a person with Alzheimer's dies from an acute episode, and it's usually put on by an infection, which could be pneumonia. But the real culprit, just like with diabetes, nobody ever puts down on a death certificate that you died from a diabetes. You usually die from heart failure or congestive failures or other types of failures, but it's caused by, for many years, the work of the diabetes. So Alzheimer's is in that same classification. So yes, you do die from Alzheimer's. Now there are caregivers are being more aggressive in making sure that the doctor understands that, you know, they died from Alzheimer's. So that's why the numbers now are getting to be more real within the medical community. But yes, it is a neurological, irreversible, incurable, and, you know, progressive. And that's how we define it within our organization.
And it's also always been thought that people who are older, 70, 80, 90, have Alzheimer's. But now you're finding more people who are younger with this being inflicted with.
And that's because we are getting it diagnosed more accurately, and that the physicians, the medical community is far more aware of it. And so but the new wave that's happening now in the medical community is they're starting to figure out that there's more other types of neurocognitive disorders as well, which is Lewy bodies, which is vascular dementia, which is the frontal temporal lobe. And these are different other disorders that have been really for a very long time go undiagnosed. And that way, and because of not having them diagnosed appropriately, you can't develop a care plan for them if you don't know what they're suffering from. And the other new, I call it a rub or a thorn in our side, is that physicians are using the word dementia. Well, you don't have Alzheimer's, but you have dementia. Well, what does that mean? I mean, that's like saying you got a fever. You got a, you know, are you going to walk out of the doctor's office and say, "Oh, I got a fever," and not ask what's causing it? It's the same thing with dementia. And the medical term for dementia is that you have two or more adult daily living activities that you can no longer do anymore. Then they bring in that medical term, dementia.
Really?
But it really doesn't tell you. It really doesn't tell you what are you really, what's affecting, what is making that dementia happen. What is the perpetrator or whatever, you know? So you really got to nail down. Okay, doc, so you're saying I'm suffering with two or more adult daily living activities that I can't do anymore, but what's causing it, doc? That's the big $64,000 question that you deserve to know what it is. You deserve to know what it is. And then you don't pass it off as Alzheimer's.
Interesting.
You really want to go and be an advocate for yourself and really say, I want a neurologist to look at my loved one or for myself to get the evaluation because I really want to know what I'm suffering with. If you have Lewy bodies or you have frontal temporal lobe, it doesn't act like Alzheimer's. Now, the other side of it is that you can have multi types of factors going on. And, the biggest issue that we have with this war is, and everybody's beginning to realize, that head trauma plays a role in the way our brain deteriorates over a period of time. And so now that's one of the reasons why you're starting to see more and more younger people, too. I mean, you've got football players, you've got fighters, you've got, and these people have lived a life where those protections and things were not understood. So you are going to see more of those in our baby boomer communities. Football players have been getting this damage to their brains and going on the field when they've had a concussion that nobody knew about. I mean, of course, luckily that's all changing now. But yeah, they're at high risk. And what about our kids when they play in football in college? So all this is part of the landscape that we as an organization, as being a hands-on provider, are having to really learn more about, so we can help the families come up with a care plan that they can get the assistance and interventions and the kind of information that is critical in being able to stabilize a family throughout the disease process.
Such good words, Marion. It's so good that you are there at the helm to be able to lead people and other organizations. And I think that that's one role that you have now been playing, besides taking care of your own organization, the Alzheimer's Community Care. People are coming to you in different fields to get your help and opinions, aren't they?
Yeah. One of the biggest things we're proud of at this point in time, we're always proud of the Silver Alert, the work that we had done on that on the state level, and getting the legislation passed to actually establish a statewide program called the Silver Alert, the Florida Silver Alert program. That's why you see the dynamic message signs. And we're also trying to work with the Department of Elder Affairs on the local side, which is the Lost on Foot project, which is 5 times more detrimental to the safety of families, because there are our patients that, there's a lot of, he's never ever wandered before. I don't have to worry about her leaving because she's in a wheelchair. When a patient decides that they want to go home, I'll tell you, they are very clever about and determined to get where they want to go. And even people in wheelchairs have gotten long distance.
Oh, really?
Gone long distance.
They get up somehow,
You'd be
right?
You'd be surprised how strong that the determination is, the will. And the Lost on Foot issue is huge. But we also worked on with the Department of DCF, Department of Children and Family Services, and we helped them write this latest publication they did for their staff throughout the state of Florida on Alzheimer's disease and different aspects and how to recognize it with communication. We're very proud of that, for being a partnership with them. And our logo is on the back of the pamphlet and everything, and we did a lot of work on that. Our star here, of course, is Karen Gilbert, who is our Vice President of Education and professional training, and she put a lot of time and effort into it. So we're proud of those kinds of partnerships, because you know what? Anita, we just can't do this alone. We have to get everybody on the same page. And one of the other ways we're doing it is we become accredited by the Joint Commission. We've got this gold seal on our business cards and on our different publications. And, the Joint Commission is an international body that is supposed to accredit health agencies. And so we turned to them a few years ago, and they didn't know what to do with us. I mean, we're not a hospital, we're not a hospice, we're not a long-term care facility, we're not SNF, we're not, and we're community-based. We're a genuine community-based organization. We're where the rubber meets the road. We're with we have our daycares. Most of our daycares are all affiliated within churches, and we just spend a lot of money and financial resources into renovating their area, and it's very, very beautiful. And, of course, the congregation and the church people are very, very happy, and they're the clergy, and we're really building big, strong bridges with them and having leases with them for 20, 30 years. So we're entrenched in the community. And so we've learned how to do that because we want to be accessible. We can't possibly build 11, 12 different buildings to be accessible in the community. But getting back to the Joint Commission, they said, okay, after we met all their standards, which are 7,000. Different, all their standards, but we had 17 that we tweaked as far as that goes. So we got our accreditation, and then they put us in a category called behavioral health. We're not behavioral health. They don't know what to do with us, and yet they're a close partner with CMS. We've got to have CMS look at this issue in our families and to get financial resources, understand that this is a disease, and there should be a diagnostic rating group for them that physicians can start getting some reimbursement for the kind of work and health, medical care that our families deserve, which would back into the physicians having medical principles to follow when somebody walks in and gets the diagnosis of Alzheimer's, and not having the medical principle being, well, there's nothing more we can do. You're going to have to go home and live with it. And by the way, start checking out a nursing home.
Very bad.
Because that's
very
what's
bad.
been the historical. That's been the historical. But thank goodness for all this other attention that is going on in the state and the nation and even internationally. They realize at certain levels that something's got to be done. So there's little steps now being made in that direction, and we're hoping to be an influence in making sure that those first steps are practical and are real for our families, and that there's a lot of people out there with different answers, but giving authentic and reasonable help is what families need.
My guest, she loves these specs, actually. She loves to take a spec and make it into a big splash. Mary Barnes, CEO of Alzheimer's Community Care. Let me give you a phone number. If you'd like more information, if you'd like to volunteer, if you have a problem yourself, with yourself or with a family member, the number is 561-683-2700. That's 561-683-2700. And I know it's in advance, but aren't you having your next big Alzheimer's conference in February?
No, yep. We're going to be doing it in March.
Oh, March.
Which is March 16th and 17th. And that's going to be in 2017. And that's going to be at the Convention Center in West Palm. We are looking to have over 1,000 people the 2 days that we're doing this, as well as having our own local celebrity, who's Dr. Galvin, James Galvin, who's a specialist in Lewy body disease, which is the most misunderstood and most undiagnosed in so many ways. Brain disorder. Last year we had Kenneth Kosick, who, if everybody was watching 60 Minutes Sunday night, they saw him on Alzheimer's, which was very exciting for us because we brought that international talent to Palm Beach County last year. And he's talking about a possible new way of finding a cure, or at least addressing the need for, slowing up the disease or recognizing it. There is actually a village up in the mountains of, I'm trying to think, is it Colombia or Venezuela?
Oh, it's in a foreign country?
Yes, it's in a foreign country.
Yeah.
That has the village. Everybody that lives in that village has a mutation, can have a mutation in their DNA, which means that they have a 50-50 chance of getting Alzheimer's.
No kidding. Well, that's really something. I hadn't heard about that.
It is. It was in 60 Minutes, and he talked about it at the conference. And with having this laboratory and knowing that they have this mutation in their DNA, and it stems way back, years and years and years, generations and generations, from the Spanish, when the Spanish inquistadors came
right.
there, and that's where it all stemmed from.
Well,
so with that mutation in the human condition, it gives them a chance now to go from that, knowing that they've already got that great possibility, that they can now, as researchers, start coming up with a different profile of how they conduct their research.
Now, I know that you are so strong in Palm Beach County because that's where you started and that's where a lot of your centers are. Do you do anything in Broward?
No.
Is there anyone like you in Broward?
Not really. There's nobody like us in any other part of the country, not only because we're so comprehensive as an organization, but that's what our families need. And Newt Gingrich, back in 2008, March 25th, and I remember that because I was in Washington, D.C., and Senator Martinez asked us to participate on a panel discussion and being part of the presentation to the U.S. Senate Special Committee on Aging, the Alzheimer's Study Group report, which Newt Gingrich was the chair of it. And we were on the dais. Our caregiver, Larry Butcher, was sitting next to Maria Shriver, because Maria Shriver was part of that committee that made the presentation on the merits of the Alzheimer's Study Group report. That was worked on for a year by all levels of our communities. Harvard was there, Harvard, Yale, representatives from Yale, from different hospital different levels of the prestigious hospitals and, scientists. And they all worked on for a year on this, on the merits of the study, the Alzheimer's Study Group report. And in there, it does have a community-based organization of what it should look like, and it could be our operating manual. It could be, that's how close it is to what they identify as needed in every community. And the proposal, Newt Gingrich made the proposal to the federal government that they should look at a different way of reimbursing and having services in the community, and how to work with an organization like Alzheimer's Community Care and helping fund, because they're so specialized in what it is that's needed for that community. Something like a hospice concept, only really focusing on the neurocognitive disorders. And that's a new word you're hearing me say, instead of saying just Alzheimer's, because the American psychiatric community has come up with the term neurocognitive disorders, because everybody's been using Alzheimer's as being the umbrella, and that's not true. It's a neurocognitive disorder, and you've got Alzheimer's that fits under that, as well as Lewy body, as well as frontal temporal lobe, as well as Huntington's disease, as well as other brain disorders.
Does Parkinson's fit in there?
Yes.
Huh. Well, then I see that now. Neurocognitive disorder. Wow. So that's pretty important. NCD.
Yep. That is the new term that the American psychiatric community has come up with. And I believe it. When you say it, it makes sense. As the medical community hasn't come to recognize that yet, but I think if we keep on pushing as advocates and keep on learning it and doing it throughout different areas of our communities at all levels, that maybe it'll catch on.
And so, are there articles that I could review on that to see?
I can send you that information.
That would be great, Mary.
When it came out of, yes.
That would really excellent. Well, I do have that question though. Why haven't other areas, the counties, let's say here in South Florida, why haven't they picked up on your model?
Well,
what is it? What is it? Money? What is it? Someone that has the passion? There are a lot of people who have passion for this. What do you think it is?
I think that how did we do it with hospice? Because there hasn't been, even though the Alzheimer's Study Group report provided this, they as NIH or NIA or whoever would be the leading government person, or leading government entity, organization, or whatever, if they haven't made it like they did with hospice many, many years ago, what they did when they learned about what was going on in England, and hospice has sprung up here in this country, and they had it pretty rough there in the early years, because I know of we have board members that have been on the original board of the one that started in West Palm. There was one time they even had to pitch in money to pay the executive director of hospice because they weren't going to make payroll. The board of directors had to do that. And then the government decided to come up with, and I don't know where it came out of NIH I think it came out of NIH or some entity up there, decided to do a pilot projects throughout the country. And I don't know how many of them there were, but one was done in Connecticut. They got it. And it was a $3 million, in those days, $3 million. And we're talking the latter 60s, 70s. And they came up with a study that went on for 3 years. What would a hospice look like? What should be what would be the fundamental criteria for the services that a hospice should provide? That is followed and in place to this day. And so they came up with a certificate of need, and they identified what a hospice should provide. It'd be, physician resources, the nursing, pharmacists, the whole criteria, and that is the model for hospice. And then an agency would come together and put all those through community resources and come up with this, and they would get a certificate of need. Well, now it's become so fundamental in the dying process that in many states, and there's only 9 left, I think, at this point, that require a certificate of need, because these hospices now throughout the country are attached to physician services or hospital services, and as long as they provide this conduit of services, okay, that they can be called a hospice. It's like making bread. If you look at if you buy a loaf of bread, you don't even find the ingredients anymore because it's so acceptable what's in, a loaf of bread. So now it's been kind of the same thing with hospices. That as long as you'll get, and then you follow the coin. It's how you get reimbursement. You file reimbursements because you're identified certified hospice. Now, Florida is one of 9 states that still require a certificate of need, but I think it's only a matter of time that that's going to go away as well. When the certificate of need goes away, it does lessen the, I think, quality, but that's my own personal opinion. But anyway, I think it's only a matter of good business. After a while, it's going to change, but that's my humble opinion. But going back to your question, how does a model like ours gets identified on the national scale? And that's what it's going to take, I think. And by the way, this isn't going to go away tomorrow. This is not going to go away tomorrow. Even finding this village and finding the kind of research laboratory that they're going to be able to have, it's still going to take years to come up with any kind of solutions, unfortunately.
Well, so see, this is the interesting part, that even though cancer years ago killed people, now we find so many cancers in remission, and that people now, there are all sorts of drugs that have been worked on. I was hoping that this would happen for Alzheimer's, or for, as you said, the neurocognitive disorders. Yep,
that's what we've got to, and if they don't do this, they keep on predicting that it's going to be a financial crisis. But if you keep on doing same old, it isn't going to change.
Right.
And that's what we got to advocate for, is change. And we're a perfect example as an organization. How much our families want to keep their loved ones at home. They want to keep them in the community. And when you develop a network and a system, a healthcare system that addresses those needs on both caregiver and patient, you can't just deal with one. You've got to deal with both to be successful. Because the biggest threat that you have is you'll lose the caregiver first.
That's so true, and that's the most horrible feeling. So the caregiver's now saying, what's going to happen when I go? Who's going to take care of him or her?
That's right. And we try to make it so that you're not going to go first.
Yeah.
And you know who's bad at this? Is men. Men kill themselves for their wives because they don't want to rock the boat, or they feel that they're betraying, or they're bringing other people in that she only needs me and stuff like that.
Really?
And you become a caregiver. You can't do this alone anymore.
Yeah.
You wouldn't go into any disease without a doctor in the room. And that's where we come in. We're not a doctor, but we're a very, very important resource as an intervention.
Yes, you are. I mean, of course, years ago, I went and viewed a lot of the community care centers that you've had. And I thought what you did was so smart, as you were saying. So many of the churches lay vacant all week. And that's what the most wonderful thing that you did, that you made them into your center. And they love it. They feel now like they're doing what God's work was, actually.
We become part of their, not so much, we have our own ministry, to be totally, not religious, but spiritual.
Oh, I understand, right.
And we can adopt that, and we enhance their mission in the community because they are serving their local, and every one of our daycares is different because we're a reflection of that community.
Right.
And that's what makes it so special. That's what none of us as living beings, and we are living longer. I looked at my retirement, and they got me living till 94.
Good.
Oh, wow.
We're not letting you retire. Forget it.
I'm saying to myself, oh, my God, 94. What am I going to do from now until 94?
Yeah, right.
Anyway, I don't have to worry about that here.
No.
But anyway, but it's so we've got an important role to play. And just because you are aging doesn't mean you necessarily are going to get some form of neurocognitive disorder. If you do certain things as also, I'm not saying that you're totally going to stop a disease process, but you can slow it down, and there's certain things that we can do in our lives about eating more healthier, doing exercises, doing dancing, and doing other kinds of things that really keeps us more active.
Well, Mary, I have to just tell you, I don't want to cut you off. We're just run out of time, but I want everyone to put on your calendar March the 16th and the 17th at the Palm Beach County Convention Center. I'll be there, and hopefully we'll get 1,000 people there. But
that's
Mary,
right, if not more.
Yeah, thank you so much. Always,
I
always think of what you do for this community.
And we're having our open house on December 7th. So if you're around
December
in the area,
7th, and that's coming up
from 11 to 2. And I would love to have you stop by.
And that's at your office?
Yeah, at a principal office at 800 North Point Parkway.
Okay, I'll put it down on my calendar. Thank you.
Great. Could you please?
I will.
I would like to see you.
Thank you, Mary. Bye.
Thank you for having me.
It's always a pleasure. Bye.
Bye-bye.